Moving on, and North Korean health authorities in a rare omission have reported 6 deaths and nearly 270,000 cases of an illness suspected to be COVID-19. According to the state media, more than 1 million people have been sick with what Pyongyang refers to as fever. The country's leader, Kim Jong-un, having ordered the army to distribute medicine to the unvaccinated population. Let's cross now to Andrew Salmon from the Asia Times in Seoul. Andrew, given how closed off North Korea is, can we trust these figures being reported by state media?
I mean, frankly, I've got no way of knowing. I think no one outside Kim Jong-un's own bunker has got any way of knowing if these figures are accurate or not. But I think people here in South Korea are taking this very seriously for a couple of reasons. One is that North Korea doesn't like to admit its own problems or weaknesses. So this is very, very unusual in that respect. Secondly, this is a country with a Soviet-style, old-school medical system, which is expressly designed to contain pandemics. And North Korea has been very, very successful at keeping pandemics at arm's length. They've kept SARS, MERS, Ebola and COVID out of the country, to the best of our knowledge, thus far. But in April, they held two mass events in Pyongyang. One was a massive rally, one was a military parade. And these now look like they may well have been super spreader events with perhaps a small number of people, possibly smugglers who had crossed the border into China, picked up COVID, come back home, and now a few weeks later we have this. So it looks credible and it looks very, very worrying indeed, yeah.
Could this provide an opportunity for the West to step in and offer help, Andrew?
I mean, I think that will be what we'd all like to see, would all hope for. President Joe Biden is in Seoul this coming weekend. And the South Koreans have said we're always ready to offer humanitarian aid to North Korea and have tried to make some connections, but North Korea has not responded. So bear in mind also there are sanctions on North Korea. So refrigerated trucks, refrigerated trains. Could they cross the border? What sort of paperwork would be required? And of course, North Korea is always very, very wary about having aid groups or medical groups monitoring aid donations within the country. So I think all these things militate against a Western response, despite the widespread availability of vaccines now. I understand that producers are now actually cutting production because global rollout has been so very successful. I think what's far more likely is North Korea will go to its traditional allies and partners, Russia and or China, to use those vaccines.
Andrew Salmon reporting there from Seoul. Thank you.